They were exhausted. Some couldn't sleep more than 2, maybe 3 hours a night. Others had zero sex drive, or worse, painful sex that made intimacy unbearable. Some were told they were too old for hormone therapy. One woman had her doctor laugh in her face when she asked for help. But then something changed. They found a new path forward. They found the right kind of help. I'm going to tell the stories of 5 women who optimized their hormones to treat their menopause symptoms. And here's how their lives changed. A woman I'll call B started hormone therapy for her menopause symptoms only in January of this year. At first, it felt like things were moving sort of slowly. She began with progesterone and a low dose of estradiol in a compounded cream. But she told me she was constantly exhausted, just sort of dragging through her days with the classic menopause fatigue. So she asked her doctor, who she describes as fantastic, if there was anything else that she could try. That's when she was prescribed testosterone therapy. She said, my sex life just exploded and my husband was very happy. I felt like I was 20 again. But even with improved libido, the fatigue didn't really budge much. Then she decided to experiment, increasing her estradiol dose, and that seemed to be the turning point. She told me, now I'm not exhausted anymore. And maybe best of all, she added this, now I have the energy to exercise. It's awesome. T calls herself a hormone optimization success story. After 18 months of struggling without any hormones, she finally found a specialist who really knew what they were doing. Her new provider started her on a combination of estradiol and progesterone in a single oral capsule. She told me that within about a week, 80% of her menopause symptoms just disappeared. She also began using a low-dose vaginal estrogen tablet, and that small change meant she could finally sleep all the way through the night without having to wake up like 5 times to go to the bathroom. Now she wakes up maybe once or sometimes not at all. She also added testosterone to her regimen, and within a few weeks, her daytime energy returned. No more sort of dragging through the afternoons. As she put it, I will happily take all of these hormones forever. Kay has been optimizing her hormones for about 4 years now. She told me, I feel great, I'm strong, I've got lots of energy, and sex is great. That last part was kind of a big deal. She was really ready to give up on intimacy altogether because, frankly, it hurt so much. She was dealing with painful sex after menopause, which is an extremely common issue. It took time, but things finally turned around for her. Now that it's better, she said, my husband and I enjoy it almost daily. She credits a hormone specialist in Florida for changing her life. I was scared and I was skeptical at first after hearing so much bad information about hormone optimization for menopause, she told me. But her hormone provider explained the difference between harmful drug combinations and true hormone optimization with bioidentical hormones. And that made all the difference for her. There's just so much misinformation, she told me. It's scary when you're trying to find somebody who actually knows what they're doing. Her advice to other women: find somebody who truly understands bioidentical hormone therapy and hormone optimization. It can change your life. Well, Lee's story starts with long-haul COVID. She'd already been dealing with chronic fatigue, but after COVID, it got quite a bit worse. It took over a year and a lot of frustration before she finally figured out the root problem. That was her hormones. She worked with a hormone optimization provider to gradually increase her estradiol dosing, and then she adjusted her compounded testosterone. She started at 1 milligram all the way up to 3 milligrams a day. It took a while, but now it's working. She says, my energy levels are finally approaching normal. She hasn't started a regular workout routine yet, but she's optimistic that she'll be able to soon. And she also added, sexual function is returning too. It was hard to find a provider who was willing to increase my doses the way I had hoped they would. Being a retired nurse practitioner with a solid background in hormone therapy gave me the confidence to push back. S told me plainly, yes, I am a hormone optimization success story. She's now sleeping better, No more brain fog after she went through menopause. Hot flashes are completely gone, and she's seen a huge improvement in her libido. But what stood out most for her was the peace of mind that she's experienced. My mother passed from a massive heart attack. She was denied hormone therapy because of the flawed Women's Health Initiative study. S said, "I'm not sure what state I'd be in today if I hadn't found a wonderful hormone specialist who changed the course I was potentially going down." She also told me it's not just about feeling better in the moment. It's knowing that I'm actually protecting my long-term health. That's a pretty huge shift. Hormone optimization isn't just about symptom relief, as important as those symptoms are. It's also about reducing your real health risks: heart disease, Alzheimer's, osteoporosis. Well, I've heard from a lot of women who felt better after optimizing their hormones, but who also saw dramatic changes in their bone density. A lot of women have moved from osteoporosis to osteopenia, or from osteopenia back into the normal range of bone density. These aren't just one-off cases. They reflect what we know from the research, the science. Estradiol, when it's at optimal blood levels, helps to prevent osteoporosis after menopause and might even reverse it. Here's what a couple of women had to say. MF said this: "I'm 63 now, and I had my last period when I was 52, so that's 11 years ago. At 50, I was diagnosed with osteoporosis, but I didn't find out about hormone therapy for bone density until I was 59. Since then, I've been using bioidentical hormone pellets. Now my osteoporosis has improved, and I only have osteopenia now. My dry eye and vaginal atrophy and vaginal irritation are gone. My energy is back. I feel mentally sharper, and I don't have to struggle to maintain my weight anymore." She also added, "I'm really hopeful that I won't be a burden to my children in the future, thanks to the changes that I've been making, even though I started a little bit late." Another woman, D, told me, "I'm 59. I've been optimizing my hormones for 2 years. I'm on estradiol and progesterone, estradiol in a pellet and progesterone in a capsule. Lots of testing and adjusting and changing doses has finally done the trick. I also take a thyroid medication for hypothyroidism, and I reversed my osteopenia." She added, "I walk at least 2 miles a day, and I eat whole foods, nothing processed." These outcomes aren't rare. They're what happens when hormones are brought back to optimal and not just normal levels. And when a woman works with a hormone optimization provider who really knows how to titrate those doses over time until things finally click, that's when it really works. So I've been sharing some powerful stories of women who made that leap into hormone optimization. And most of them, or all that I've talked to, have absolutely no regrets. These stories help women like you to aspire to that kind of transformation. But even though these stories are amazing, and I've heard hundreds more just like them, you might be thinking, well, I'm still just not sure. Maybe you're hesitant because of something you read online, or maybe your doctor even told you that hormone therapy isn't safe. Maybe you're just confused. You're not sure how hormone optimization really works. Or maybe you're feeling stuck, paralyzed by too many opinions and not enough clarity. Well, I created a resource just for you. It's designed to help clear up all that confusion. It can help you feel confident about what's possible after menopause. If you're ready to start advocating for your own health with any doctor, if you're ready to take that next step, take a look at this next video.